Cancer is a battle both mentally and physically, and oftentimes physical side effects result that need close attention. Jim Ferrara is the owner of Functional Transformation Clinic in Sarasota, and he's here to talk about some of the therapies they provide. Good to see you. Thanks for joining us.
Nice to meet you. Thank you for having me.
Tell us about your clinic and what you specialize in.
My clinic is a lymphedema therapy clinic. We specialize in lymphedema therapy. We do other therapies also, but our specialty is lymphedema therapy. And lymphedema is the accumulation of fluid in your interstitial spaces, either your arms, your neck, head, your stomach, or your legs. It can be in any of those places.
Okay, and why is it important to treat this and recognize it as early as possible?
Because the earlier you treat it, the more reversible it is. If you get it in stage 1, lymphedema is reversible. If it hits stage 2, it's no more reversible at that point in time. And if it hits stage 3, you're subject to wounds and cellulitis and infections.
Okay, so knowing that early detection is important, your clinic has something called a Sozo machine, right? What can you tell us about that? And I know there's one sitting next to me. We'll get a shot of it so that you can explain. What does this do?
The Sozo is an early detection machine used for cancer patients. So if you go to have surgery or getting ready to have radiation therapy done before surgery, you come here to the clinic and you get tested on the machine, and it gives us a baseline before you have the surgery or before you have the treatment. So we have a baseline to know what you are prior to the surgery or the treatment. Then 10 days after the surgery, you come again for the second time and you get tested again, and that gives us a reading. And if we go over 6% change, that means we put you in a garment or start treatment immediately. And then we send you away for a month, and you come back in a month again, and if you're still at that testing time and a month later, you're still above that 6%, we start lymphedema therapy immediately and treat you like a regular lymphedema patient at that point in time.
Okay, you mentioned that the Sozo machine is specific for cancer patients. What is it about cancer surgery that can result in lymphedema?
A lot of times when they do cancer surgery, the cancer spreads to your lymph system. So they're going to be taking lymph nodes typically, not always, but typically taking lymph nodes out. Or when you're going through the radiation or chemotherapy, that could damage the lymph nodes also. So the combination of the surgery and the treatments following the surgery can do damage to the lymph system, which can cause accumulation of fluid. So you've probably heard where doctors tell women who've had breast cancer surgery never have blood pressure taken in their arm. That's for that reason, because anything simple as a blood pressure being taken in their arm can trigger their arm to blow up 3 times the size of normal.
Okay, so the point of this is to get that baseline you mentioned pre-surgery, and that way your clinic can monitor it through the post-op period.
And treat it if it gets out of it.
Let's talk a little bit about treatment. What are the typical treatments for the early stages of lymphedema?
For the early stages of lymphedema, if you're stage 1, we don't typically have to wrap, but we do what's called complete decongestive therapy. Complete decongestive therapy involves 4 different techniques. One is the manual lymph drainage. That's typically the quote massage part, and that's the easiest for the patient. Then we teach skin care. The skin care is important, keeping the skin lotioned, preventing any cracks, because if you get a crack and you have excessive fluid buildup, that can cause a wound.
Right.
And then exercise. The exercise helps a natural pumping effect and keeps the fluid out of the limb. Then we do what's called multi-layer short stretch compression, where we wrap the limb and help push the fluid out. And not only does it push the fluid out, it prevents it from returning while we're treating.
All right, and you brought some pictures to share that are definitely further more advanced stage lymphedema.
And that happens if you don't treat it early.
I was going to say, this is a very good example of why you come to see you. Explain a little bit with the before and after what we're seeing here.
So the one over to the left is the before, and the one to the right is the after. This gentleman lost approximately 34 centimeters of fluid from before and after his treatment.
Okay, and some other pictures, again, show the extent that lymphedema can get to if you aren't treating it.
And this is a lady who was before an injury to her leg. She was following me on Facebook, and liked what she was seeing, but was leery about getting treatment.
Sure.
And so she decided, after she banged into her leg into a chair, she developed a wound.
Okay, so then she wanted to treat. You were able to do some compression, I believe, in
Yep.
the after picture?
And that's her leg afterwards in that garment. And that's a custom garment that we also do in our clinic, where we measure the person for someone whose leg's not a typical size leg, shaped leg, that a normal over-the-counter garment isn't going to fit on properly.
Got it.
We do what's called custom garments, where we fit that garment specifically for that patient.
All right, well, lymphedema can definitely turn into a serious condition, so it's great to know that the technology to catch it early and then get the necessary treatment is available right here on the Suncoast. For more information, you can go to ftSarasotaclinic.com to learn more about functional transformation.